So when corporations don't pay their taxes, what it does is it causes underfunding of public services, particularly in the health sector where I work. We do not have sufficient nurses on the workflow. We do not have sufficient supplies because of no funding. We also cannot get the necessary quality the health system deserves so that people are treated, and you will not even find sufficient facilities across the country.
Going into this coronavirus pandemic, the NHS was already very stretched. Every winter, we entered into an even worse winter crisis, and I know that all of us were worried. All of us working on the front lines were worried about how we were going to cope with the winter crisis in and of itself without a pandemic on top of it. And seeing what was happening, for example, in Italy, which was sort of the forewarning of what was to come, that was really terrifying for us. Italy has double the number of intensive care beds per population than we do.
A depender do número de pacientes graves que você tem numa enfermaria, exige-se que se tenha um mínimo de profissionais de enfermagem. Sabemos que hoje, na maioria dos hospitais do Brasil e em São Paulo, esse número é sempre abaixo, então acaba sobrecarregando aqueles que estão ali. Enfermarias que deveriam ter 3, 4 enfermeiros num plantão de 12 horas, tem um enfermeiro.
So with COVID-19 spreading all across the world, it becomes very, very clear that underfunding has caused all of these serious problems for the system, the health sectors.
As a result of the NHS being inadequately funded, what we're seeing is huge pressures on staff. Currently, the most common reason for staff to be off sick is because of stress-related problems, and that stress that is arising at work. This week alone, we have 30,000 staff who are off sick.
When people go to work with so much to do, understaffing, and they have to stay longer hours on the job floor, it causes burnout. They are not able to do sufficiently well as they should do, and that helps to undermine the public services.
No Brasil, atualmente, existe uma perda em impostos no valor correspondente a 15 bilhões de dólares. Esse valor, ele corresponde a 82 bilhões de reais perdidos anualmente em impostos. Isso daria para nós hoje contemplarmos 2 milhões de salários de enfermeiros no Brasil anualmente.
African governments lose over 7 billion annually through corporate tax abuse. With that much money, we could employ over 250,000 nurses throughout Africa.
Healthcare workers were thought of as being heroes, and I don't think any of us really went into this profession to be a hero or to be venerated in any way. Being a hero means that you're putting yourself on the line, and that isn't an inherent part of the job. And I think that really needs to be reflected in the way that the government protects us, and that has to come through funding.
Nós agradecemos, mas não é suficiente os aplausos que nos foram dados. A gente quer reconhecimento no dia a dia. A gente quer material adequado para trabalhar, a gente quer condições adequadas para trabalhar.
It's a question of how we are valuing our frontline workers, our key workers during this pandemic. Do we just clap for them, or do we reflect that in terms of a pay increase that means my nursing colleagues aren't having to use food banks?
People who are breeding this system, I like to appeal to them to look back and see 30,000 children dying annually that could be prevented if they would only pay their fair share of tax. I think it's about time that they right the wrong.